We know that intrathecal baclofen is extremely effective for most people with severe spasticity. The pump battery life is only 6.5 years, so an operation is needed at this time to replace your pump. This can be quite a daunting thought, but rest assured we have many people having new pumps each year. Some people are even on their third or fourth pump. The pump and catheter are surgically implanted, generally in the abdomen, although some people have it in their chest wall. A catheter is tunneled under the skin, from the pump to the back, and it sits in the thoracic spine, delivering baclofen into the intrathecal space. This is a fluid-filled area around the spinal cord. The pump is working 24 hours a day and means you don't have to take lots of tablets, which may cause side effects. Patients report that having a pump makes a big difference in their quality of life. We have approximately 200 people with pumps. In the past, pumps were always replaced under general anesthetic and therefore people required a few nights in hospital. But now there are more options. One option is to have your pump replaced under local anesthetic, rather than having a general anesthetic. There are lots of benefits to this, including a shorter time in hospital. It is even possible to do this in a day, so you don't have to stay overnight. Not needing a general anesthetic means no risk to your breathing, less chance of feeling sick, and less risk of developing chest or urine infections. We have asked patients what their views and concerns are regarding pump replacement, as well as discussing it with your team of neurologists, neurosurgeons, anesthetists, nurses and therapists. With all this information, we have developed a pathway to have most people's pumps replaced under local anesthetic, with discharge home a few hours after the procedure. This has been extremely successful with very positive feedback from patients, although we understand this won't be the right option for everyone. Let us explain this pathway. A few months before your replacement date, we will discuss the options with you. Your team will provide information and explain if the preferred and safest way of having your pump replaced is under local anesthetic. This may not be the right option for everyone, and some people may need a general anesthetic. We will discuss the risks and benefits with you and plan your care together. You will have a pre-admission assessment discussion, often completed on the telephone or through a video consultation. Once a surgical date is agreed with you, any tests needed such as blood tests or swabs will be organized at the hospital or somewhere local to you, a few days before your admission. You may be asked to isolate to prevent catching an infection until your admission date. Your carers may need to continue to wear personal protective equipment such as a mask, apron and gloves. You will come into hospital a night before the procedure or early on the day of your replacement. Thank you for watching this episode. If you feel ready to learn more about what happens on the day of your procedure, please see episode 2. This film was funded by the National Brain Appeal, the charity dedicated to supporting the National Hospital for Neurology and Neurosurgery.